is Christine Rincon, and we're going to be doing the assessment for skin, hair, nails, and regional lymphatics. State your name.
Vladimir Monperus.
And he's going to help me out with this examination. So the first thing we're going to do is we're going to check the overall skin. So we look at the patient, and the overall skin tone is normally even and consistent with genetic background. Dark-skinned patients usually have lighter skin, palms, and soles and nails. The thickness is evenly thin over most of the body, but thickened in areas like the palms and nail beds. So now we're going to go ahead and look a little bit more. Okay. So open your mouth, please. Okay, so the patient has moist mucous membranes. The skin texture feels smooth over most of the body. Bilaterally, we check for skin temperature. The skin feels warm, which is a good indicator of good circulation. Now we check for skin turgor. If I can get my gloves on. Check in the area of the clavicles by pinching the skin. Check for elasticity, and it bounces right back. So that's a good indicator of hydration. Now we check the hair. So first we check the color. The color of the hair is dark, and that comes from melanin. The texture, you can see that the hair looks shiny and is appropriate for style, and the distribution is good. There are no bald spots. Did you have any pain when I touched your head?
Nope.
Okay. So now we check the nails. Okay, so the color of the nails is translucent window to the nail bed. The shape of the nails are smooth and shiny, appropriate for style. And now we'll check the angle. So we like for the angle of the nail beds to be about 160 degrees. So that's 160 degrees. Some abnormal variations are spooning of the nails, and that can show iron deficiency. Clubbing of the nails is an indicator of poor oxygenation, so it could have been from emphysema or heart disease. So we can also check the capillary refill. We push on the nail bed, and then it goes from blanching to pink, and we like it for it to be under 2 seconds. So a patient has under 2 seconds, so that's a good indicator of good circulation. We'll check for the skull. The head is normal cephalic in shape, meaning it's round, symmetrical skull related to body size. It also has the normal protrusions from the forehead, the parietal area, the occipital area, and the mastoid process. We'll also check now for the temporal artery. So we'll check kind of a little over the ears. All right, there's a good pulse there. Good pulse there. All right, so now we'll palpate the temporomandibular joint, ask the patient to open his mouth. Okay, and so did you have any pain or? Okay,
nope.
So that's good. Now we check the face. So we check the expression is appropriate to mood and situation. We can also see that the eyebrows, the palpebral fissures, the nasolabial folds, and the mouth are all symmetrical, meaning if you put it in half, everything for the most part looks the same to the other side. There's no involuntary facial movements, and there's no edema in the face. We can also check if there were any lesions. He doesn't have any lesions, but if there were any lesions, we can check for the A, B, C, D, E of the lesions. So we check for asymmetry, borders. We can check the color, malignant versus benign lesions will have different colors, meaning the benign one will have one color versus the malignant one will have many different colors. Distribution also, and the evolution of the lesion, meaning does it look different over time, did it get bigger? We can also check the neck. So first thing, we can kind of shine a light over it to check for any obvious swelling. No swelling or masses or anything like that. We now check for symmetrical head position. So the head position is symmetrical. We can also check the muscles for symmetry. So everything pretty much looks like each other. Now we do the range of motion. So in range of motion, we'll have the patient touch the chin to chest. Okay, now left, right. Okay, now without elevating the shoulders, bring your ear to your shoulder. Opposite side. Okay, and now bring your head back. Okay, did you have any pain with range of motion? So that's good. So good range of motion.